All right, this is our presentation on opioid addiction treatment. So to start, we kind of should start off with what this whole thing even is. So opioid addiction treatment is the use of physician-directed and monitored practices such as therapy and synthetic medications to help individuals recover from substance abuse disorders. This is primarily done through something called medication assistance treatment, which is the simultaneous use of behavior therapies in conjunction with medications to provide the best results for the individual. The three main medications that are used for this are Suboxone, Methadone, and Naltrexone, which we will get into breaking down those a bit more later. So the implications and risks both in favor and against opioid addiction treatment. So for the risks of using this, there is the potentiality of the individual becoming addicted to the treatment drug. While this is rare, it is possible, as well as the likelihood of the individual having to be on this medication for the rest of their life to avoid a relapse. However, the side effects or risks of not using this treatment are the individuals continuing to abuse opioid drugs, leading to overdose and the potential of death from this overdose. These individuals have higher risk of depression and suicide rates, as well as not being enrolled in one of these programs. The user might try and quit anyway and just cut the use of the drugs cold turkey, which more than 75% of the time results in a relapse, and in a lot of cases an overdose and death because of it. So while we acknowledge that there are both positive and negative implications of opioid addiction treatment, for the purpose of this presentation we'll be focusing primarily on being in favor of this treatment.
All right, so the social implications that are included will be, just to start, doctors are being trained to help patients become more aware of who is best fit for the prescribed opioids, so to prevent mistreatment of the drug. This can help socially because it may help educate people before even using the drug or the drugs to help with the addiction. And then medical assisted treatment, like Megan said, for opioid use disorder is one of the main social implications. And then economic implications. So I just have a bunch of statistics of US economics cost of opioid use disorder is $471 billion. The US fatal opioid overdose cost is $550 billion. And this is, I think it was yearly. But substance use treatment cost for Michigan in total is $134.5 million. And then methadone treatment, including medication and integrated psychosocial and medical support services, per week, it's $126. And then there is the yearly cost as well. And then this word, buprenorphine, for a stable patient provided in a certified opioid treatment program, or OTP, including medication, twice weekly visits are $115 per week. And then the legal political implications, I have a few of the history background on each of the tax acts. So the first one, the Harrison Narcotics Tax Act of 1914, restricted the use of opioids to pain treatment and outlawed their use for addiction management. And then the act framed opioid dependence and substance abuse in general as a criminal or moral rather than a medical issue. So 30,000 physicians, some engaged in unethical practice, but anyway, they were prosecuted under this act. And then they worked on another act that was started in the 1960s and showed that the treatment of opioid addiction with methadone led to reduced criminal behavior and improved function. And then the success of their research paved the way for methadone to become the first legally allowed opioid treatment for addiction since 1914. And then the last act that's been in action, I guess, was started in 1970 and went and included the Narcotic Addict Treatment Act of 1974 and allowed dispensation of specific opioids from federally waived clinics.
Okay, so the overall advantages of medical assisted treatment, there's quite a few. So first of all, the FDA has approved it to be safe and has seen it to be effective. It's been effective in reducing death rate, like overdose due to overdose. It's also helped like physically and mentally people who have been treated this way. It's improved social functioning and treatment retention, and it's just been seen to be super successul. It's also an evidence-based practice, so there's been a lot of research seeing that it has worked. And then the drugs also block other drugs and help reduce cravings. So more specifically, buprenorphine. So this drug helps to reduce drug cravings and works to block other drugs from attaching to brain receptors so that the person doesn't feel anything when they do take more drugs. It is also difficult to overdose because there is a ceiling capped on this one. Although people can overdose, it's very difficult to. And then specifically, this drug avoids withdrawal symptoms and sticks on brain receptors for 24 hours, so people can have more time to think about, what's going on. For naloxone, this also reduces drug cravings and blocks other drugs from attaching to brain receptors. This one, though, is different. It's very difficult to overdose because when naloxone is injected, the withdrawal symptoms are immediate and intense. So, but that being said, it is, very difficult to overdose, and doctors are more willing to give that as a take-home prescription because of that. And then the pill version, there's little withdrawal symptoms unless, of course, they inject it. And this one is also not addictive and is not dependent or doesn't build up tolerance.
All right, some of the disadvantages of buprenorphine is that there's still risk of overdosing, especially while taking opioid, alcohol, sedatives, or current medications that interact with it. Some of the side effects can lead to sedation, respiratory depression, cerebral anoxia, and possibly death. These treatment sessions can also be expensive, especially those who may be addicted to opioids and other substances. It can also be a lack of effectiveness in patients who require a higher dose. Some of the disadvantages for naloxone is that it does not activate the receptors like buprenorphine. This can lead to a person feeling immediate and intensive withdrawal pains. It can also stay in the body to 30 to 90 minutes, but opioids can last longer in the body and they can still experience the effects of the opioid. Some of the side effects that can cause vomiting, the lowering amount of blood going to the skin and intestines, and increased blood going to the major organs like the brain, heart, and kidney. This can also cause pulmonary edema and changes of timing and patterns of the person's heartbeat.
So an ethical and biblical perspective on this that I came up with is that medication-assisted treatment, including therapy and counseling to help people change behaviors, is the most ethical option for people that suffer with opioid addiction. So addiction can be considered a medical disease that alters the brain. It's not just a moral failure. In fact, when people are opioid addicted, they get more receptors for opioids, so it makes it really hard for them to quit, even if they want to. Also, getting high, similar to getting drunk, is often considered biblically wrong, but the medication Suboxone does not get people high. It just fills the receptors so that they don't feel like they need to take more opioids, and it keeps them from overdosing oftentimes. This is a quote from one of the articles that I read. It says, "An addiction does not involve being taken over by evil or demonic substance. It stems from a disordered relationship with one." So I think a lot of times the drugs themselves have been considered evil, and so that's why it's hard for people to think about taking a medication long term, but that's not actually the case. It's the relationship with the drug. And then self-condemnation and guilt are issues that are often associated with addiction, and those can't be treated by a medication, but they can be addressed through Christian counseling. So these are some verses from the Bible that support this view, which is, if a person is in a Christian community, it is appropriate to ask them about their use and to hold them accountable if you talk to them about it. So that's a verse from Matthew that basically says that within the church that you're responsible for confronting and helping other people overcome sin in their lives. And then Matthew 26 verse 41 says, "Watch and pray that you may not enter into temptation. The spirit indeed is willing, but the flesh is weak." So this just goes along with having that medication can help people to overcome the desires of their flesh if they really want to stop being addicted to a certain drug. So it's a combination, not just the pills, but also the therapy. And then finally, this passage from Romans, which is basically saying that there's no condemnation for people that are in Jesus, and a relationship with Jesus can help with a lot of the guilt and the condemnation associated with drug addiction. And so there definitely is a chance to start over and a chance to use not only drugs, but like the Spirit's power to walk in a new life. So I took a look at Cornerstone's biblical position, and this is a quote straight from the student handbook. It says, "As followers of Christ, our commitment is to cultivate the fruit of the Spirit, including self-control in our lives. The use of illegal drugs and the abuse of prescription or non-prescription medications impairs our judgment, hinders our effective witness for Christ, and entangles us in patterns and habits that keep us from effectively serving the Lord." So some of the drugs that can be used in medically assisted treatment are prescribed by doctors, so those are probably acceptable on campus, but I'm sure there would be accountability involved. And Cornerstone University also offers counseling services to help students that are struggling with these kind of things. Additionally, in the virtues of Cornerstone, there's a few things that I wanted to point out. And Cornerstone believes that through Jesus' death and resurrection, he atoned for all sins. So Jesus' forgiveness should remove all the shame of addiction that people may struggle with. Also, Cornerstone University emphasizes the virtue of self-discipline and says that it's not by a believer's own strength, but with the help of the Holy Spirit. And finally, Cornerstone University emphasizes grace, and that when someone fails, that the aim is to restore them and not to condemn them. So this is a summary of the logic that we used for the biblical view and our view based on all the evidence that we found. So while we found that there are both positive and negative implications of opioid addiction treatment with medication, it is not contradicted by the Bible or Cornerstone University policies. According to the Bible, there is forgiveness for guilt associated with opioid addictions and an acknowledgement of the inability of humans to change their behaviors apart from the help of the Holy Spirit and community of believers. Medications which can help control cravings and help people addicted to opioids to stop. They can help people to stop using the drugs, producing a high, and often saves their lives and gives them ability to receive therapy that they need. And then those are our sources. Thank you.